Welcome, everybody. We are back with another podcast. We are once again speaking with Dr. Steve Olsen of the Snohomish Naturopathic Clinic. We have information, and he has been a guest before. So if you would like more information about him and his clinic, please refer to the original or our first podcast. Welcome, Dr. Olsen.
Hello, everybody.
There you are. So one of the things, since we covered quite a bit in the first podcast, kind of move along, I'd like to speak to the first aid aspect and or a in-home first aid kit for people. The list you offer on your website under first aid is quite extensive. So if we could just touch on some of the things that maybe people could have on hand and what that looks like. How's that sound?
Sounds good. Yep.
So, some of the basic things for people in home are, well, off your list are allergies and injuries such as sprains and or bruising, headache, these kind of tension in the body. How would somebody go about putting together a kit in home? Are you a resource for that, or do you have information that they can then go and find the homeopathic in a local health center?
Right. Well, let's first define first aid. So first aid is usually something that is from a trauma from the outside, like a sports injury, a work-related injury, sunstroke, a burn, a cut, from a knife or something like that. So it's usually something sudden that happens to the body from the outside. Not so much allergies. Allergies is usually chronic problem, because it comes every year and it's got to do with the immune system not working right or something like that. So
right.
So we're going to talk just about first aid, and so these are usually what the remedy look like. It's just a little tube from a pharmacy, like this is from Boron, and you can get this at Fred Meyer or health food store, or I have them too. They're about usually like $7 to $10, and they have a whole lot of little granules in them. And then they have the tube, you kind of twist it like this, and the granules will drop out into here. And if you drop out about 6 or 7 of them, and then you let them melt under the tongue. And usually one dose is most of the time all you need, because first aid things get better quite quickly with the right remedy. And I think if there's one important remedy to learn, it's Arnica montana. It's the most used homeopathic remedy in the world every day. And and it's probably one of the most used medicines in the world every day, because it's basically for any physical trauma to the body that causes pain. And that's a lot, because people are always falling down or bumping into things, or having a car accident, having a sports injury, getting hit on the head. All of these physical trauma situations respond to Arnica.
So this is one that would be, you could put Arnica in a kit in numerous for numerous things, such as one of the things that I have done a lot of in the past is backpacking, and it's a spatial, it's a weight thing, so we're always very careful about how much we take, but that would be one that would be taken along. Is that correct?
Oh, absolutely. Yeah, absolutely. Especially if you've got kids, or like you say, going for a hike and you're going to, if you step off a rock and sprain your ankle or something like that. And so with Arnica, it's usually pain that is worse from touch. So if you put pressure on the area that you traumatized and it's more painful, then that's a very good confirming symptom for arnica.
Oh.
And it's probably the things I've seen it mostly used for are things like sprained ankles or a bump on the head, or sudden maybe trauma to the back, but really you can use it safely for pain that comes from physical trauma, which covers so many different things. And there's no harm in giving a dose of arnica. And if it's right, usually within about 5 to 10 minutes, the pain will subside and the person will be able to go on with their activity, whatever they were doing before.
So what would be another item if you were putting together a kit of, say, 5 to 10 things to have in a first aid bag?
Okay.
What would be another item somebody might want to have?
I think probably the next most important remedy is for food poisoning. That's because it's just so unpleasant to have it, and it can last for like 3 days of vomiting or diarrhea or something like that. If you go to a country where you're not used to the type of water they have, or you just eat at a restaurant where the food had too much bacteria in it or something like that, and when you get that weak feeling like something's terribly wrong and you start feeling nausea and vomiting or diarrhea, then you can take the remedy called arsenicum album. And that's the potency of that is 30C. So I have some right here. It says arsenicum album on it. And that usually works, again, within about half an hour, depending on how quickly you can take it. If you've been sick for a few hours and you haven't been able to get a hold of it, might take about maybe 2 or 3 hours to work, a couple of doses. But the quicker you take it, the quicker the nausea will go away and the quicker the food poisoning will go away. And there's also...
Oh, I'm sorry. Go ahead.
That's okay. That's okay.
I was going to ask, in that kind of a scenario,
yeah,
if you go ahead, if you think you've been food poisoned, but you're on the verge of not really knowing if you have, but you're feeling kind of funky.
Yeah.
If you go ahead and take it, but you aren't, and you aren't experienced with food poisoning, is there any,
side effect?
Thank you.
Yeah.
Are there any side effects from taking ahead?
No, there's no side effect to take just one dose and wait. And
so it's pretty foolproof.
Usually, yeah. I mean, if you take one dose of any remedy and it's wrong, you really can't do yourself any harm. If you take 3 doses over the course of a day and it's wrong, about 20% of the people will start to get a side effect. But just one dose is not enough. But I just want to say that arsenicum, the reason you know it's arsenicum after maybe a few hours of being sick is that the more nausea you get, the more your mouth will become dry. And then the more the patient will want to have little sips of water just to put moisture on the tongue. Yeah. They won't want to drink a big amount because that'll make the vomiting worse, but they will feel like they need little sips of water, and their whole body might become colder and colder, like a chill feeling. So the chill and the sips of water kind of confirms that arsenicum is definitely going to be the right treatment. And yeah, okay. I've personally used it quite a few times, and I probably use it at least once a month. Someone needs it. There's also just like a gastroenteritis that is sort of contagious, and it makes its way around in our society and community.
Yes, it does.
And all of a sudden, you just feel like you have the stomach flu. It probably wasn't from food poisoning. It's just the stomach flu from a bacteria that you managed to get into your system somehow from touching something. And it usually works for that as well. It's
good to know.
Number one remedy to take to Mexico, or you're going to go traveling and you're going to be drinking water that you're not used to. I would definitely definitely take it with you. Yeah.
So on dosages,
Hmm.
whether you're dealing with adult or children, is there a difference? How do people regulate that? How do they know what's best?
So first of all, you take one dose, which is like about 6 to 8 of these little granules.
Is that for
Or
either adult or children?
yeah, adult or children's the same. And then if it's liquid, you can take about 15 to 20 drops if it's a liquid remedy, and you kind of shake it up first. And then, like I said, usually one dose is enough, but let's say a few hours later, the nausea starts to come back. It's a particularly virulent or difficult bacteria to get rid of.
Mhm.
And the symptoms start to return, then you take a second dose. And if the symptoms start to return, you have to take a third dose. And usually if you have to take more than 3 doses, then you have to go stronger. So this is a 30C, and then a stronger would be like a 200C. But they're a little bit harder to find. So, and usually the 30C is strong enough. It's I don't think I've ever seen a food poisoning where you need a stronger than a 30. But maybe the next remedy I'll talk about is for burn pain. So any kind of like pouring boiling water on your hand, or a fire burn, or even a very, very severe sunburn or something like that, or putting your hand on a hot piece of metal and the whole hand is scalded and the skin is coming off, and that type of thing. When the pain is really severe and it's over a larger area, the 30C will be strong enough maybe to help the pain for a few minutes. But if the pain comes rushing back, you definitely need 200C. And sometimes I think, with other, like, let's say a person was burned in different parts of their body, then a 1000 might be needed. And one case I had was she was about 4 years old, and she was playing in the snow and her hands were really cold. So she came in and she put her hands on the fireplace metal
Oh,
that was red hot. She put her hand on it. I guess she didn't know that it was, so she burnt her whole hand and she was screaming in pain. So we gave the Cantharis, is the name of the remedy, Cantharis 30C, and that's actually all she needed. But the pain stopped maybe about a minute later, and then she put her glove on, went and played in the snow, and when she came back, she took the glove off and the skin tore off her hand.
oh,
And
yeah.
she just looked at it like, that's interesting. The skin just tore off my hand. Like
Kids are
normally
amazing.
a burn like that normally would probably hurt for a week or two.
Yeah.
And her burn pain was gone in like a minute or two.
So,
3.
so in conjunction to something like that, would you use a cream version or a liquid version of arnica too on
No,
the skin?
arnica is really for muscle, tendon, ligament,
Okay.
and doesn't treat burn pain or anything like that. But
Okay.
Cantharis, another case I had was a guy who was mowing his lawn, and the lawnmower stopped, and he for some reason put his hand on the muffler, and he burned his hand. And in that case, the same thing, the whole hand was burned. In that case, I needed to give him the 200, and I think I even gave him the 1 amp. But after I gave him the 1000 dose, the pain completely stopped. He got up the next morning and he came and showed me, and he said, there's absolutely no pain. And another case
So,
I had was a guy who dropped his motorcycle, and the muffler again was on his whole leg. He was a teenager, and he was in shorts, so the whole area of his leg was burned, and he was in agony. And his mother came and picked up the Cantharis and gave it to him, and within, I don't know, 10 minutes or so, he was completely out of pain. So I don't know in hospitals why they don't use it. I think
well,
it's a wonderful remedy.
that's a whole different conversation.
Yeah.
So with all the sports and teams that go on here in Snohomish and
Hmm.
young kids, teenagers,
Yeah.
these kind of things would be good to have in a first aid kit. Is this like, would somebody come, does somebody need to come and have a consultation with you to know what to have
Um,
in a kit? Is that something they can
well,
find on your website?
I've got a book here called Homeopathy, Nature's Way to Better Health, and it's all about first aid remedies. There's about 12 of them that you can learn. So this is available from Amazon. And
Excellent.
if you get this book and then you start building a first aid kit and take it where you go, then I think there's about 4 or 5 different remedies for sports injuries, because sometimes sports injuries, there's more stiffness after, maybe after the initial trauma, the
Right.
whole joint becomes very stiff, or it becomes worse from motion, or it becomes, swollen and difficult to heal for some other reason. So there's other remedies to learn for sports injuries, and there's remedies in here for sunstroke and for like stepping on a nail or getting a puncture wound, or like an animal bite. And so
So
yeah,
that, yeah, that was one of my, under the allergies, I guess I didn't speak very well to that. I was more thinking of, out on a ball field, out hiking, is an allergy reaction to a bug bite or a sting.
all
I'm
right,
assuming that's a
yeah,
different different type of
right,
homeopathic.
okay. That type of allergy would be like, that is kind of a first aid. Like if someone was to get anaphylaxis from a bee sting,
Right.
then there's a remedy called Apis mellifica, which is made from the honeybee. And I've seen that save people's lives before, because if they can't breathe, then you can give that remedy Apis, and they can start breathing again. You should, in that situation, definitely call 911. Maybe they're going to need adrenaline as well to help them out. But if you have Apis, you can give it, and and then um, and then mosquito bites. There's a remedy for sort of an allergy to mosquito bites when they won't stop itching.
Right.
So those 2 remedies.
Made me itch.
Yeah, there's there are some spiders around here that are quite poisonous, and the hobo spider can produce a very severe necrosis of the tissue, where it actually turns black, and then the tissue dies, and as it does that, the there's tremendous burning pain where the spider was biting. It's very, very painful, but there is an antidote. There is a remedy for an antidote to that, but it's not very common. It's much more common to get a mosquito bite or a bee sting, isn't it?
Right, right. But because we have those, that would be a remedy that somebody would want in a kit, especially, say they're a landscaper, or,
Mm-hmm.
just cleaning out their
Mm-hmm. We're going
gardens and
camping,
things. Yeah.
something like
So
that. Yeah.
so uh the book is available on Amazon.
Mm-hmm.
I'm assuming if somebody calls and makes an appointment and wants to speak with you, you
Mm-hmm.
have room in your schedule for those kind of things, kind of a
If
face.
someone calls me for a first aid problem, I just tell them over the phone which remedy they can get, and they can either get it wherever they can, wherever it's most available, and then just take one dose and see if it helps. As long as it's not life threatening or something. But sometimes I even say, okay, take this remedy and then go to the hospital. You know,
Right. Start
because but by the time they
start the
get
action.
there, and check in and everything, if the remedy's working, then they tell them, well, you're doing better now, so you can go home again. But
Okay.
I've had that happen a few times with things. Yeah.
So I've just touched on a few things
Mm-hmm.
surrounding first aid kits and the different types of things that you would have in different kits. I guess is
Mm-hmm.
how I'm thinking of it. Is there
Mm-hmm.
something that you will want to add that people need to know about?
I think car sickness is pretty common with little kids.
Ah,
I know my daughter had it really bad, and but there's like 3 or 4 good remedies that people can take when they understand a little bit what type of car sickness they have, and especially what makes it better. Like my daughter's car sickness was better when the windows was open and she had cool air blowing on her. And so you know, you can get to know how each remedy wants to help, you know,
Yeah.
find the best one. It's and then there's good ones for head injuries, you know, back injuries. Like head injuries can lead to things like foggy thinking and
Ah.
memory problems,
So
concussion.
we talking concussions,
Yeah,
that kind of a
concussion
thing?
kind of situations. When there's nausea after the concussion or weakness, the whole body or one side of the body goes weak. And then there's other remedies here for this one is good for nausea as well. So yeah, there's a whole bunch of actually, you know, if you know 15 remedies, that's about 95% of everything that can happen first aid.
Wow.
Yeah, it's not that many really.
That isn't that many. That's
Hmm.
pretty astounding that
Mm-hmm.
you can treat so many things with that few of
Yeah.
remedies. Well, but that's good because, well, one, they're not very big and they fit in small spaces.
Yeah. I think another really useful one to know is it's called calendula, and it's for like cuts and scrapes to skin or surgery. So anytime the skin is cut with a knife or broken, and then the trouble is that the wound can get infected, and it's also painful. You know, so little kids who scrape their knee or something, you can put calendula cream right on it.
Ah.
And if you do that right away, there's no way that wound is ever going to get infected. So that's the first wonderful thing. The other nice thing is that it takes the pain away quite quickly. And especially, I would use calendula before any surgery. Take a dose of 30C, the stuff, and then take it again right after the surgery. And the chance of that wound becoming infected is 95, 98, 99% decreased possibility of the wound getting
Wow.
infected, which is actually a big problem. I think something like 80,000 people die every year in the United States post-surgically from wound infection.
Right.
So that would decrease that tremendously.
So
If you
you would
take
use
calendula.
both the remedy and the cream kind of hand in hand.
You could do both. There's no harm in doing both. Yeah. Mm-hmm.
Well, that's excellent.
Mm-hmm. Yeah, it's a good
So,
way to start learning homeopathy because the next stage from that is learning for colds and flu and ear infections and sore throats and all that, or bladder infections. So so that's the next level to homeopathy is learning all the acute remedies, and then the next level is learning for all the chronic stuff.
so I'm going to make the assumption, and correct me if I'm kind of out there in left field on this one. There are so many aspects to the remedies. If you have an elderly family member that has chronic UTIs or
Mm-hmm.
the foggy memory,
Mm-hmm.
this is something that will help them?
Yes. Yeah. When you treat someone chronically, you have to be more than 90, 98, 99, or 100% match. If you're
So
treating,
that is more of an appointment with you
yeah,
to pinpoint what that is.
right. That would be like an hour and a
Okay,
half appointment to find that
gotcha.
exact personal remedy for that person. But first aid, I don't think it has to be that exact. I mean, if someone gets hit on the head with a baseball bat, 99, I mean, almost 100% of the people that happens to are going to respond to arnica in a positive way.
Okay.
They won't even get a goose egg. It's just like, well, why don't I have a goose egg? I should have a goose egg, but I don't. or it was starting to form and then it went back down.
That's
Something like
pretty
that. So arnica,
phenomenal.
yeah, I've seen people sprain their ankle, fall down on the tennis court in agony with a sprained ankle. I ran to my car, gave them some arnica, and within 5 minutes they got up and walked around, and their opponent said, okay, well, you want to play? And they're like, okay, let's play.
Wow.
And so that's like 10-minute healing. And I think you really have to
That's pretty astounding.
experience it for yourself and your own children to see how rapid it is and how safe it is, because remember, these are very tiny doses of plants and minerals, so they really work with the body to make that healing system probably 60, 80, 100% stronger for that time that it's needed to do that healing. And
Excellent.
it's totally safe. You take one dose of a remedy and you can never do anyone any harm, and you can avert having some big, huge problem later on. I heard of someone who was actually kicked in the stomach by a horse, and for 30 years they had abdominal pain. And someone just at dinner time or something like that, they met a homeopath, and the homeopath said, well, did you try arnica for that stomach pain? And they said, no. He took arnica, and that abdominal pain from being kicked in the stomach was gone in like, I don't know, a few days or something like that.
Holy cow.
Yeah, I know.
That's pretty amazing.
I've seen people with car accidents who had chronic pain from, back pain from being whiplashed and that type of thing, and weakness and, mental fog. Give arnica, and within a week, they're like lifting up their furniture and moving it all around and cleaning their whole house again. And like all the pain is gone.
Wow.
So, I mean, they are very powerful remedies that can help people. And the quicker you take them after an injury or a first aid situation, the quicker you'll be the quicker the healing will start.
Excellent. I think that is kind of the gist of getting oneself together and getting the book and starting to figure out how to help treat themselves and their family.
Okay.
Excellent.
Excellent. Okay.
Well,
thanks for the interview.
thank you for coming on again, and I hope the rest of your day is lovely.
Okay.
Thank you, Steve.
Thanks so much for the interview. Okay.
Bye-bye.
Bye.
Hey everybody, if you have enjoyed this video and you've seen some of the others, please give it a like and be sure to subscribe to the channel for future interviews that are coming up, and learn more about the local practitioners you live around and with here in Snohomish. Thanks.